Life has just become much more fun with the introduction of platelet-rich plasma treatments. The following is a presentation of the results of scalp treatment with PRP. I never knew that my scalp is shaped like an old-fashioned incandescent light bulb until I saw my before and after photos. Hello, I'm Jack Silvers, a dermatologist at Brentwood Dermatology Medical Group in West Los Angeles. Um, the before picture is my hair at age 51 at the end of a summer in which I swam in the swimming pool with my nieces and nephew and had a great time. And the after picture with more hair is about 3 months after a few sessions of platelet-rich plasma on my scalp. This next set of pictures depicts the front of my scalp taken at the same times that the back side of the scalp were taken. Um, at the onset, I used to feel that my hair had lost its vigor and sort of life. It appeared lifeless on top. And lately, at the time the after picture was taken, I felt that my hair had gained back its vigor. And I was thinking that it may be because of the air in Southern California was very dry. But now that I look at the photos, I know why I felt that way. The pictures and this video were taken 1 week after my last PRP treatment session. And usually patients notice hair growth anywhere from a month to 3 months after their treatment sessions or the last treatment session. If you notice, I have more hair on my right frontal hairline than my left frontal hairline. I had one extra session on the right side and more than the left side. And lo and behold, I have more hair on the right frontal hairline, even though the right side of my scalp, my face, everything is smaller and I had less hair there, and that's why initially I opted to have one treatment there. I presented my scalp before and after PRP pictures simply to inform you what is possible with this treatment. However, what I've seen in my office and at the meetings, the results for different people are highly varied. And at this time, I don't have a way of knowing who's a good candidate, who's not. I've been surprised many times patients I didn't think would respond as well, responded amazingly impressively. Wound care and burn care are two applications of PRP that have resulted or result in consistent great outcomes. I remove skin cancers via Mohs micrographic surgery, and at times the patient and I decide to let the wound heal up on its own as opposed to suturing it. I've injected PRP on the edges of the wound and have noted a great healing and faster, much faster expedited healing. Specifically, one 80-something-year-old gentleman, I removed a large recurrent basal cell carcinoma on the back of his ear. He was an active smoker. We decided not to close the wound because I didn't think a flap or a graft would take. And usually when the cartilage is exposed, patients have pain. I offered him PRP, did the PRP around the wound edges. He had no pain while he was healing and much faster healing than I had ever seen. Burn patients benefit from PRP significantly. I injected the PRP through the burn, right under the skin. And specifically to tell you about one patient, I had a lady who had a wide burn on her thigh. She couldn't sleep because of the pain night after night. I offered her PRP, and the pain was gone shortly after the treatment. And she had some itch, but was able to sleep much better and run her life better and more comfortably. A number of other patients, I've seen the same thing, that burns heal up much faster with PRP injection. I'm not aware of any controlled studies in wounds or burns with PRP, meaning to treat the burn on one side of the patient with PRP and not the other side, to see by how much and whether there is faster healing. But I wish you could be at my office and see it for yourself. Another application of PRP that has resulted in great consistent outcomes has been genital rejuvenation. 2 weeks to 3 months after injecting PRP in the genitals, obviously after numbing them fully, men report much greater sensitivity and firmness. Some men have even let me know that they notice to be firm in the morning when they get up, something they hadn't experienced since their 20s. Women who've had genital PRP treatment notice much greater sensitivity and much greater pleasure. Women who have a little bit of a urinary incontinence as a result of giving birth, PRP results in greater soft tissue and more tautness of the tissue that circumscribes the urethra, and they either have had their problem resolved or greatly subsided. Many patients and their family members have asked me about possible side effects of PRP. Honestly, none that I'm aware of or I've ever read or been told that it's been published anywhere. And I don't see it to induce any side effects. I think the contents of the platelets just help cells get rid of their unwanted contents, perhaps. It increases blood flow and turns the cells back in time to be how they were at a younger age. Some patients have asked about possible chance of infection. PRP, when poured over the chest wounds after cardiothoracic surgery, has resulted in much lower incidence of infections after such an invasive surgery, just pouring it over the wound, not even injecting it on the wound edges. There has not been a reported single case of infection, and I think as long as it's prepared properly, it would be fighting infection and diminishing the chances of having an infection. Nonetheless, I don't think people should be cavalier about preparing it or injecting it into in a way that may induce the chance of having an infection. Now that I might have piqued your interest in the platelet-rich plasma treatment, I have a word of caution for you. So the blood drawing tubes come in a stack of like 25 or 50 that you just open up a nylon wrapper on top, and they are open to the air. Some dust and spores sit on top till we are ready to draw a patient's blood to send it to the lab. Whereas the Eclipse platelet-rich plasma tube comes in a sealed container. It's sterile. The fluid that's in here plus the gel contains compounds that have been shown to FDA that when the plasma is injected back into the patient's body, it's still safe for the individual. whereas we don't know that is true for the ordinary blood drawing tubes. So a word of caution would be not to try to be cheap, to have your blood drawn with a separating gel in what's called the tiger top tube, to separate the plasma and from the red blood cells to inject it back into a person's body. It should be taken and prepared in a sterile container containing compounds that are safe to be re-injected back into a human body.
Thank you for watching our video. If you have any questions, please call us at 310-826-2051 or visit us at brentwooddermatology.com.